NF to me, at least in 3 words, is empowering, hard, and everlasting.
NF to me is scary.
Scary.
Frightening.
Incurable.
Tiring.
Exhausting genetic condition.
NF is a tumor-growing condition.
Nerve tumor predisposition.
Unknown.
It's an unknown and unpredictable disease.
Unexpected.
Unexpected because you just don't really know what's going to happen.
It's a very complex disorder.
Genetic disease.
NF is a rare disease and not so rare.
I would describe it as rare.
It's not well, recognized.
Life-altering.
Painful. Awful.
Cruel.
Every day's a battle.
You feel hopeless with that. Stressful.
Frustrating.
Visible.
Annoying.
Horrible. Horrific.
Heartbreaking.
Depressing. And sometimes happy.
It can be good at the same time as bad.
It's hard because it's so much a part of my identity in both good and bad ways that it's hard to really squeeze that down into 3 words.
It can be challenging, I guess.
Courageous.
Impactful.
Empowering.
A journey.
Perseverance.
Resiliency.
It is an obstacle, but it's also conquerable.
Family.
Community.
All the people you get to meet with.
Connection. Engaging.
Love.
The Children's Tumor Foundation has built that community, and other families with NF, I feel like they are part of, a larger friendship and family.
Everyone loves each other. We're such a big family.
Interesting.
Unique.
No 2 people with NF are going to be, even in the same family, will have the same experiences.
It makes every person unique, and their stories unique and deserving to be told.
There are a lot of people who have amazing stories in this community that I love hearing.
Optimism.
Hopeful because of all the great work that CTF is doing.
Future facing.
Complex and fascinating.
Compelling to rock.
Collaboration, because we cannot solve NF without collaborating.
We need to give our patients hope.
No cure yet. And that's the most important word, that 3rd word, yet.
Been noticing that when they do
Perfect.
Oh, look, lights.
Hi, everyone. Good afternoon. Good morning. My name is Heather Thompson. I am a speech-language pathologist by training. It is so good to see you all here today. Today we have an amazing presentation with our panelists here, and it's called Weaving Whole Person Care into Your Life, Strands of Support. Let me start over again. Weaving whole person care into your life with rehabilitative therapies. And so we're presenting Kimberly Mars, Conrad Cordova, and Marianne Wendt, and I'm going to have each of them introduce themselves as we get started. So I'm a little tongue-tied because there's been just a lot of talks. Here we are. Kimberly.
Hello, everyone. I'm Kimberly Mars, and I'm a speech-language pathologist at the UC Davis Mind Institute and also at Shriners Hospitals for Children.
Hi, my name is Conrad Cordova. I have NF. I have 2 children with NF, an adult daughter and a 12-year-old with NF. I'm also a family nurse practitioner and have been in healthcare 35 plus years.
Good morning. I'm Marianne Wendt. I'm an occupational therapist with the Allegan Area Educational Service Agency, and more importantly, I am the mother of a young girl who is 17 with NF1.
All right, so as we get started today, our panelists have put together just an outstanding presentation for you. We're going to cover a few different topics. One is a discussion of habilitation and rehabilitation. We are also going to look at what is a rehabilitation team. We're going to provide information on what rehabilitation services are available for individuals of different ages, from infancy through to adulthood. And then finally discuss resources available for individuals, parents, and families. So first off, what we're going to do is talk about what rehabilitative therapies have been accessed. And so many of you completed the poll through the Whova app in advance of this presentation, and there were so many responses that indicated people were receiving services for speech, occupational therapy, physical therapy. And so we're going to look forward as these are individuals who are part of our rehabilitative or habilitative team. And so we're going to expand on these concepts today. So thanks everyone for giving some feedback through the Whova app. My first question to the panelists is, what does rehabilitation and habilitation mean? And who are members of a rehab or habilitation team? All right.
So we're going to start first. Most of you are very familiar with the term rehabilitation. If you've had a surgery, a spinal fusion, an amputation, you've gone in and you've met with a team of people that help you gain back skills that you previously had, whether it's walking, feeding, talking. Me specifically, I work in the 0 to 3 population, so I'm working with individuals that do not yet have those skills, and so that's where habilitation comes in. That is being able to gain skills that you did not previously have. As we age and grow, there are things that people can learn to do that they may have not done before, but as you're older, you'll hear that term rehabilitation more than you will habilitation. So it's kind of an age thing. The younger you are, the more likely you are to get habilitative services, versus the older you are, you're more likely to get rehabilitative services.
Perfect. Thank you so much. Does anybody else want to add on to that at all? Yeah, Kimberly?
So just the team can vary by hospital, by location, private practice. There's so many different rehabilitation teams, and it can include nurses, it can include therapists such as PTs or OTs or speech therapists, but it really varies based on the individual or the patient needs.
Yeah.
And it's definitely multidisciplinary. There's many different facets of people's needs who need strengthening or rehabilitation or relearning, whether it's feeding themselves or walking or maintaining balance. There are professionals that help you regain balance and walk appropriately and get referrals for assistive devices if needed. It's definitely multidisciplinary from both mental and physical.
Perfect. Thank you so much. So the next question that I have for our panel is, what habilitation services are available to support infants, toddlers, and children from birth to 3 years of age? So let's start with the tiny humans. All right.
I love the tiny humans. Those are my people. Well, the good news is, for those of you that have younger children, early intervention services are mandated by the federal government. The bad news is that those early intervention services may not be covered financially by the state that you live within. I'm blessed enough to work in a state where I can go in and pick up as many kids as I want and provide those services at no cost to those families. And I will tell you that within my state, neurofibromatosis is an automatic qualifier. So when you are looking for the earlier intervention services that you get, that's 0 to 3 versus early Head Start services, Help Me Grow. In Michigan, we have something called Build Up Michigan. Those are those services that go anywhere before the school age. Once your children become of school age, then those services will be directly provided through the school districts that your address is aligned with. And those will be to benefit your child in areas that help them succeed within education. So you won't necessarily have a physical therapist in there to help regain walking skills, but they might help build tolerance for sitting and being able to attend to classroom activities.
Yeah. Thank you so much. And Kimberly, do you want to add some information there?
Yeah, so from a speech and language standpoint, parents or caregivers can contact their early intervention regional center. For California, where I'm from, we have early start services for the 0 to 3 population. So if there's any sort of delay with language or motor skills or feeding, that's where parents or caregivers can go to inquire or get an assessment for their child.
Can I also mention one more thing? With automatic qualifiers like neurofibromatosis, even if the child is not showing a deficit at the time that we do the evaluation, with an early intervention, we are allowed to keep that child on our caseload to monitor them, to make sure that if they do start to fall behind, we can bring in the appropriate pieces of the puzzle to make sure they get that whole care to be successful.
And anything else to add before we move on to our next age range? Okay. All right, thank you to you both for that. So the next question I have for the panel is, what habilitation services are available to support children from 3 to 5 years of age?
So again, this is going to be, typically they're funded through your school system if you're looking at that lens. And so a child might be put into an early childhood special education classroom. They might have walk-in services through the school district. And then you might start also seeing, we're kind of neglecting private practice. I apologize for that. Depending on what's going on with your child, you might be able to get a medical referral to get services within private practices through your local hospitals, local therapy clinics. And depending on what you like to do, there's even recreational therapists and music therapists that would be able to work with a younger child to help them gain skills or get back skills that they might be losing due to dysfunction or progression of disease.
Thank you so much.
And then from a speech and language standpoint, for the 3 and 5-year-olds, you can get the earlier intervention or their school-based programs, private practices, or university clinics. We also want to kind of keep an eye on concerns for like autism and like social communication skills and feeding. So if there's any concerns at this time, that's where you would go.
Yeah, that's a really good point. And we see it sometimes in young children with neurofibromatosis type 1. They might have social communication concerns that may not be firmly a diagnosis of autism, but they might have social pragmatic concerns that qualify them to have an educational diagnosis of ASD, which will then allow them to have more services. So even though it's not a medical diagnosis of ASD, if they get an educational one, that might open the door for more services. So I'd be happy to talk with other folks if anyone has questions about that afterwards. So that's a really good point that you raised. So excellent. And Conrad, anything to add with this young
Nothing
population?
at this point. Nothing at this population.
Okay, so then this is like our rapid fire panel. Okay, so moving on let's get through the whole lifespan. What rehabilitation services are available to support school-age children with NF?
So with your school-age children that are if you're seeking services within the school, they're going to be protected under the Individuals with Disabilities Education Act. IDEA might be how you've heard it. And so a lot of you, when you took our poll, identified that your child or you may have had a 504, which allows for accommodations within the school. So that could be increased testing time, testing away from bigger populations, so it's a smaller environment. It could be, for my daughter, she has an accommodation that gives her a different colored paper, so it's easier for her to read with her OPG that she has. This also could be different seating availability to a child. If you have a child that struggles with mobility, it could be making sure that classroom does not have rugs or that there's pathways to navigate walkers, wheelchairs, or other assistive devices for that child. Then you also have your IEPs, your individualized education plans, and that's when we're starting in the school system to look at direct intervention. Does that child need to work with someone, a fabulous speech therapist, to help understand concepts or to be able to socialize with peers? Do they need to work with an occupational therapist on fine motor, sensory needs, or maybe they're part of that picky eaters club because, food is not really their thing?
I know my children, at least in Arizona, had great speech therapy and occupational therapy through the schools. My daughter had trouble with speech initially, and I think until grade 5, right? Till 5th grade, she had speech therapy, and then she graduated. She said, she doesn't need us anymore. And now she won't stop talking.
Which we're really excited about.
And my 12-year-old boy through 5th grade also had speech therapy and occupational therapy to assist with his handwriting skills because he has really trouble handwriting. He's going to be a physician, I can tell. He has trouble with handwriting. But after that, they stopped it because he excelled and he did very well. He stutters now, but that's in part because of the medication he's on for ADHD. But the schools across at least Southern Arizona and in Tucson have great OT and speech therapy through the schools. If we wanted physical therapy, if that were necessary, we would go through the Children's Clinic in Southern Arizona, which helps with those referrals, but that part's not been necessary for us, but it is available.
Excellent, thank you so much.
One thing I would like to add is with the IEP, if any hearing accommodations need to be made, that could be included as well in these plans for the child. Things like FM systems, and I believe the hearing talk a little bit later will cover some of that.
Yeah, thank you so much. That's important. And I think, when we're thinking about IEPs and 504 plans, to the greatest extent possible, we want children accessing like the standard educational curriculum, and supports can be provided through that 504 plan in the classroom, so they're learning alongside their same-aged peers. And then for IEPs, for speech therapy at least, and I know with other, other special ed services like occupational therapy or physical therapy, there can be push-in services that go into the classroom, as well as like pull-out services, which might be individualized or small group instruction. And so these supports can be provided for students, so that's excellent. All right, any additional comments before we move on to late teens?
I would also say that if you have a child in the school, don't be afraid to reach out. Most of the schools will have a teacher consultant for the visually impaired as well, because I know that's a big problem for a lot of our kiddos with NF, is making sure they have those supports. Like I said, my daughter has interventions with different colors. She also gets larger print. And so those are things that it's for her just an accommodation, but there is a TCVI in most school districts across the country that can help make sure that visual needs are being met in addition to hearing or speech.
And TVI refers to teacher of the visually impaired?
Yeah.
Is that, yeah.
Teacher consultants or teachers of the visually impaired, yes.
Excellent. That's perfect. Thank you so much. Okay, so moving forward, what rehabilitation services are available to support late teens and young adults with NF? And who wants to start? We'll turn it to Kimberly first.
Okay.
Yeah.
So as your child is transitioning from school age to young adulthood, it's recommended that they continue to be assessed and evaluated, or and as needed, have that therapy for delays with things like occupational motor skills, physical therapy, or speech. And if they don't qualify for services through the school system, you could reach out to private practices, university clinics to receive those services, also an evaluation, highlighting some speech services that they can receive that might be helpful. Include services for reading or writing or dyslexia. And dyslexia, for those of you, as a friendly reminder, it's like when people have language comprehension is solid, but the word decoding is where the problem is, and so we can definitely help with that. But regional centers also can cover services for therapies and rehab up to 21 years.
So it's just a matter of finding out where the services are and understanding that there's schools, hospitals, private practices, and then if there's a university program in speech language pathology, occupational therapy, physical therapy, sometimes they have on-campus clinics, and they're free or low cost in many locations, so that's also a great resource for older children. And we have, at least in our clinic at Sac State, we have several older children who come in and they're working on their language-based learning disability, dyslexia profiles. Even well into their late teens and early adolescence, you can strengthen these skills through practice and reading comprehension. So, yeah, thanks, Kimberly. Who else would like to add more information?
Anything, Conrad? I think at this age group too, we're looking a lot at their social participation, and some of that is done through sports. And so my advice to all of you, if you have a young child or a teenager, is to look into adaptive sports. Derek is a fine example of that, our keynote. He was a rugby player, and it's an adapted sport. But there are recreational therapists in all of your communities that can help your child ski if they want to ski despite an amputation or braces or balance issues. And so look for those types of therapists. They're not really talked much about, but they are available to help you and help your child, if it's your child, find those things that they want to do and enjoy in life and help them be successful in them.
Thank you so much. So then we can think about what rehab services are available to support adults with NF. Okay, and Kimberly, you want to start us out?
Sure. So as we get to adulthood, we want to think about career and job supports and executive functioning skills, cognitive communication, thinking about things like attention and memory, how to advocate for a person in a workplace, how to or communicate appropriately in a professional way. We also want to think about things like swallowing. If you're going to be taking a pill, can you swallow that pill? Is it getting stuck, or is it are you going to have some difficulty swallowing that pill? So thinking about things like signs of aspiration, which is when food or liquid goes down into the lungs versus the stomach or the esophagus. So these are all things to keep in mind for adults from a speech and language standpoint.
Yeah, absolutely.
When we're looking at mobility, we're looking at strength and balance. And so this might be we're having a physical therapist be a part of your care team to help work on those things. I know recently I had my daughter work with a physical therapist because her balance wasn't looking the greatest. And so she just did 6 weeks with a physical therapist to start learning some of those exercises, because parents, hear me out, you tell them to do something and they're probably going to do the exact opposite. But if you pay a professional therapist to tell your child to do something, or your young adult to do something, they might be just a tiny bit more likely to cooperate with those ideas. I could be wrong there. The other thing that we're looking at a lot with adults are your activities of daily living. And so what are the things that you want to do or need to do in your life, and how can an occupational therapist, a speech language pathologist, or a recreational therapist help you complete those? Sorry, it's been a long day. And so looking at things like maybe you love to cook, but because of everything that's going on, medications that you're taking, or different mobility issues that you're having, maybe you can't attend to cooking very well because you fatigue. And so you might be able to make simple things, but you can't make the big things that you used to love making. And so working with an occupational therapist or an orientation and mobility specialist can help you figure out strategies within your own home so that maybe you move a chair or a stool into your kitchen so that you can sit while you're sitting there and stirring your roux. Or maybe you take dishes that you use frequently and you keep them on the counter instead of having to take them from the dishwasher or the sink and into the cabinet, and you're doing those extra steps. And so we'll look at ways to streamline how you do your daily activities, and this includes hygiene in the bathroom, things like that, so that you're not constantly feeling fatigued, because there's nothing worse than taking a shower and then sweating because you tried to get dressed and it was exhausting.
Yeah, those are all really good points. And Conrad?
She covered what I was going to say, so it's
Sorry.
good.
Oh,
No,
sorry.
you're doing great.
Yeah, I
I'm
think
very happy.
these are all really great points and great avenues to think about. We want to think about holistic care. We want to think about whole person living and quality of life. And I think accessing different rehab or rehabilitative support services throughout the lifespan, like understanding that there's these resources available, can help improve quality of life. And when I think about what do people really need, everyone needs a home, a job, and a friend. And we need to have resources and supports available so that everyone can achieve those things, right? So, understanding its lifespan. So, the other thing that I think about is like workforce skill development and communication skills as people move into the workforce. And, what are some of the needs associated with that? Do folks need, more information about social communication skills needed to communicate with coworkers or colleagues? Those skills about, how do you communicate with your family and loved ones differently than you might communicate with a boss or with coworkers? And, speech language pathology services can be provided to help kind of that workforce skill development so that people can access the careers that they want to be successful in. So, so moving forward, there's also information about recommendations and referrals and information for parents and caregivers. So what's some information that we can provide to parents and caregivers? Anybody wants to start?
As far as
Conrad, go ahead. Yep.
Sorry. As far as myself as a parent and a healthcare provider, if my children have needs, I have a really good idea of where I need to send them or who I need to call to get a referral to get them to the right place, but many people don't know that. So what I've done with some of my patients who I've identified that needed referrals, I've sent them to the appropriate physical therapists or the appropriate physicians who could get them to the therapy that they needed, or the important contacts or phone numbers, or I've made calls myself to these people and say, hey, I have a family who has a need, and I've been able to do that, but not everyone has the time to do that. And that's what's difficult. That's why then we as parents advocating for our children with NF have to be very resourceful. So all of you are from all over the country, which is so wonderful to see. Find out who those resources are in your community to be able to get the referrals that you need for your child or for yourself. But you have to be proactive and go out and seek them out yourself. But if you have like an NF clinic or someone that you go to, many of those facilities have a coordinator, a patient care coordinator who you can make contact with, who can direct you to those resources or to the right people to get referrals. Unless you have very good insurance that covers anything without a referral, that's not as common, and most people don't have that. So find a patient care coordinator in your clinics that can direct you to the right place. And I know many of you who are parents started educating yourself about NF when your children were diagnosed or when you were diagnosed, but what's out there on Google is terrifying. So if you're gonna do research yourself and educate yourself, find credible resources and don't go to websites that might lead you to just be paralyzed, because that happened to us as when we were new parents and had our first diagnosis with our daughter. So, and now that we armed ourselves with education, we feel empowered, and that's what education does. It empowers you to find the right resources.
Thank you. That's really important to note and to comment on. All right, so moving forward. Oh,
I'd like to add something.
Yeah,
so for
absolutely.
the parent training and education piece, a lot of therapists see a child for 30 minutes to an hour, and a lot of parents can be a part of those therapy sessions and take home some of the key learning points to apply to like activities of daily living, or creating a calendar, or just incorporating a lot of the therapy techniques that have been applied in the therapy to things outside, so that the skills generalize. I think that's a really important piece, that the parents are a part of the 30-minute or hour therapy session, for example, in speech. I just really value those parents that are there and wanting to learn so that they can generalize the skills that are learned in those sessions to everyday life. So it's vital that parents are trained and educated as well.
Yeah, absolutely. I think that's important. The other thing that I'm thinking about is when we're engaging in rehab services, or seeing a variety of different providers. Many of these appointments are once or twice a week. It involves transportation to a clinic or a setting to be where the therapist is at. Does anybody have any suggestions on, what happens if people are really far, they live in a remote geographical location and they're trying to access rehab services? What are some things that families could do, or what are some options? Anybody have any thoughts on that?
We're a bit, lucky is the wrong word, but thanks to COVID, we've had an increase in access to telehealth, which has been huge. I know initially when COVID first started, that was the only way I was allowed to see my caseload, unless occasionally I would show up in front of their house and roll around on the ground to try and demonstrate the positions that I needed parents to put their children in order to do what needed to be done to help develop the skill we were working on. And fortunately, I believe, the federal government is still allowing us to have the access to the teletherapy, but again, we're looking at what are the connectivity issues for individuals that are in those more rural areas. And so the access may not be great. And I know a lot of the individuals that are doing telehealth are getting certified in multiple states, so that when you have states like Wyoming, where there are not a lot of resources for those populations, that you can maybe work with someone who is out of Illinois or out of Michigan or out of California or Missouri. And so I think the benefit, though, just comparing my journey 17 years ago to today, is that we have more connectivity through the internet. There are therapists that create content online through Facebook, Pinterest, Snapchat. They create web pages where you can get information like OT Innovations, which focuses on sensory and mental health. That's Tina Champagne. There's a shout out for her. No connection, but she's super awesome. But you have these resources that you can use, but we'll come back to the idea that I would still prefer that everyone, when you feel like you have a deficit, reach out to your primary care provider, even if they aren't an NF specialist, and say, hey, can we have this looked at? Is it possible for me to work with a PT or an OT for energy conservation? Or I've noticed my child is doing this. Is there a way to get this checked out? Within school districts, if you have a younger child that's with the school age, the school has 45 days to respond to your request for evaluation. And so if you are an individual that's, working with a school-age child, but adults, please, these services are available to you. And I feel like within your population of older adults with NF1, NF2, and schwannomatosis, that they're very underutilized. And part of that is an error on the therapist. There's just not a lot of education. The group that I went to school with was very well educated on neurofibromatosis and the different things that could happen within. But that's because we had a parent, myself, who was able to educate on those things. And so, as practitioners, I'm sure we all, when we go to our professional conferences, do our best to spread the word and let people know that these things exist. And I think that therapies are getting better. But adults, please ask if you notice that you're getting tired. Ask if you can have a functional workload task analysis, that's a big word, I'm so sorry, an eval by a PT or an OT to make sure that you can do what you love to do, because we want you to enjoy life. I don't want you sitting at home not being able to do the things that have meaning and value and make this life beautiful.
Yeah, thank you so much.
Sorry.
No, don't apologize.
I love skills for living. So.
It's fabulous. Anyone want to add anything else?
No.
I believe the next slide actually provides some online resources, but speech therapy is delivered online as well through telehealth, and I think Marianne covered what I wanted to mention. But next we included some resources for all of you. The first is the American Speech and Language Hearing Association, which if you are in a rural area, you can find a professional that might be only providing telehealth services or services in your area. You just enter in a zip code. I know a lot of families, especially during COVID, couldn't find a therapist to help for physical therapy, occupational therapy, or speech. It seemed that there's just a shortage. But if you go onto this website, you can actually reach out to a speech pathologist or an audiologist directly. Their information is there. I've also included information for general organizations like the National Institution on Deafness and Other Communication Disorders, and then Vestibular Disorders Association as well, which is a non-profit for people that might be having difficulty with like balance or dizziness. And then there's also the Communication Access Resources. So the National Deaf Center, it provides lots of resources for parents and families that might want more information about their accessibility rights and like educational accommodations. So I think you'll find all of those resources very helpful.
Excellent. And then there's one more slide with additional resources with a Facebook page of NF Moms Rock.
It's the shameless plug, right? So many of you, if you're not, join it. It's a wealth of information of people who have kind of suffered through the been there, done that, but are there to help newly diagnosed or individuals that maybe have been doing this for a while but weren't connected online. But you can ask questions there. We've started some discussion threads, and we are working to possibly move to a Discord for a platform, just because we're able to thread our ideas on Discord a little bit better than we can in NF Moms Rock on Facebook. It's Facebook, sorry, I'm old. It's harder to thread those ideas and topics there so they can kind of get lost. And with the Discord platform that we're working on, it won't be launched probably until the end of July, just because I'm walking into the woods for 3 weeks. But we will be able to have very specific topic threads that you can go into, so you can talk about microdeletions, you can talk about feeding disorders, you can talk about vestibular, you can talk about different diagnoses, you can talk about IEPs versus 504s. And so don't be afraid to reach out to your community. I know we have a kind of infamous TikToker in the room as well. Sorry. And so don't be afraid to reach out to those individuals to kind of get a perspective, because I know for me and my journey personally, I had the advantage of having a medical background, so I knew the questions to ask and the things to look for. But what I didn't have was someone who's been there, done that, and lived with NF. And so watching, especially this younger generation, Gen Z, man, you guys are on fire. They have been a wonderful resource, not only to me, but to my child with NF, because she can finally see someone who is a reflection of her versus her mom, who has not experienced pain, has not experienced the social isolation, and then I have uncertainty for her future, but it's not the same as the uncertainty that she feels for her future being in a digital age where she can look things up and be terrified.
Right. And so managing online information, and also, I think parent involvement as well in accessing information that's online is important as well. So thanks for sharing these resources. So with about 8 minutes left in our panel, we now have the opportunity, we really wanted to spend time opening it up to questions so that we could answer your specific questions around rehabilitative or habilitative therapies. So we have a microphone. Who wants to start? And just tell us your name as well, if you don't mind. Just tell us your name before you ask your question so we can get to know you. Yeah.
I'm Valerie, and mine is more of a comment than a question, if that's okay.
Yep.
I just wanted to tell you I loved your information on IEPs. Yeah. I've been a special ed teacher for 15 years, and I just want to add out there that you parents know your kids better than anybody. Ask, advocate, demand. And on the accommodations, get creative. They have accommodation banks, but you know your kids better, and your teachers. Get creative with those accommodations. And on the inclusion piece, there's a big difference between inclusion and included. So make sure that you just kind of know that just because your child's getting push-in services, that they're not at the back of the room getting ignored as the kid with the para with them, and that they're truly being included. I just wanted to add that part.
Thank you so much.
So many parents don't know to look for those things. So.
Yeah, absolutely. So maybe front of the classroom with their para, involved in all the classroom activities. And then I love the piece that you had about, ask and ask and ask. Yeah, I think that's important. So,
if I could respond to you, my kids had special education teachers, which were wonderful. I have a couple of family members who are special education teachers, so kudos to you for taking that role. I know it's challenging, but I know it's also probably very rewarding. But thank you so much for choosing that as a passionate career. So just a thank you to you as a parent from children with an F.
Thank you.
Hi, my name's Tanya. I have a 15-year-old, so he's very functioning. He's in a general ed classroom and doing very well. So his biggest challenge is executive function. And in the IEP world, I have trouble finding out where that lives in terms of asking for those accommodations. And I'm just wondering for some advice on, as I'm going to another one very soon, how to ask for that, because I know how to advocate for speech and I know how to advocate for OT, but the executive function piece, like just how do you manage your lunch? How do you get to that locker with the combination that's older than time and get that horrible mechanics to work? Who do I ask for that, and what accommodations maybe should I be asking for?
That's a great question.
Excellent question. So I'm happy to speak.
Do you want to go first?
Go ahead. You go ahead, please.
So I'm an OT. Obviously, I love executive functioning, as does speech. But that would be if your child has speech therapy or occupational therapy already. I would start with that practitioner. Some school districts have access to a protocol called the brief, which is an assessment that looks at executive functioning. And so that's one way to kind of get a picture of where your child is functioning within that scope or within that area. And so that would be the first step, is to look at testing possibly for executive functioning. If your district does not have access to that, sometimes it can be done outpatient within the medical community through a psychologist, speech therapist, OT. It's a matter of finding someone that actually is trained in giving that particular assessment. But when it comes to those things, you can break it down and say it's time management and organization. So is there a way to create either alerts? He's not going to want a picture schedule. We're dealing with a teenager here. They don't want anything that is going to make them look like
they don't fit in. And so it could be alerts on a smartphone, or if he's allowed to have technology that kind of says this. You can also talk to the school, possibly depending on what the lockers look like. Is there a way to have a keyed lock or a different type of lock that he can open easier without having to navigate those fine print? If you've got a visual impairment, there's a strike against you. If you have issues with mobility within your hand, trying to rotate that dial, there's another issue for you. So is there a different type of lock that we can have on that locker to help with the organization? And then possibly practicing the routine to get from class to class before session starts. We did that with my son who's autistic. We would take him into the classroom or into the school building before session started, and we would practice going from class to class, and he actually got the accommodation of getting to meet his teachers ahead of time too. But that could be something where you can practice the routine or possibly videotape it so that when he's at home, he can look at that route and kind of understand some of those landmarks, because some of these schools are ginormous.
And then also I think about that IEP and thinking about, the special education teacher mentioned about specific goals with things specific to executive functioning, such as like initiation or like getting started with like daily tasks, like creating a schedule, planning, things like memory. These are all things that you can incorporate either with the occupational therapist or the speech language pathologist. Sometimes the parents bring ideas for goals to the table for those IEP meetings, or you can email your therapist to ask them if this can be included, or maybe there's an activity that you can incorporate to really support your child. You know your child best and what your child likes, but you can definitely see where some of their weaknesses are. But the psychologist or the occupational therapist or speech therapist that does the testing might have more insight as to where to start for targeting and strengthening those executive functioning skills. So
That's a great question. Thank you so much. I think we've got time for one more. Yep, absolutely.
I talk loud, so I hope I'm not talking too loud on this.
No, you're great.
Hi, my name is Jessica, and I know regarding 504 plans, my son has been great in school, completely. So now he's going into high school, but he just started infusions about 6 weeks ago. And a mom in the office of my son's school made a comment, get him into 504 plan before high school because it's going to be tougher. But I guess it's more just advice. What would you give for him? Because he hasn't been at that point where he doesn't have bad grades. His hearing's okay. There was no disabilities I had to worry about up until now. But since he's going to be a freshman, I really don't know where I should start or if I should plan for something that may not happen.
Yeah, that's a great question. Does anybody want to start?
So I would call the school district and say, this is the medical change that we've had in our lives. I'd like to be considered for a 504 plan because this is not something that's going to impact, his access to education in terms of the learning part of it, but in the accessibility part of it. And so you want to make sure that maybe he has more comfortable seating, maybe he has access to an elevator if it's a multi-story school, maybe he's able to leave classes and have more time to transition from room to room because his mobility is impacted. And if he has to use, sorry, go ahead, please.
Oh, no, I mean, that's what the school just excused, his absences for treatments. But when I spoke with the counselor, she's like, well, there's really not much we can do because he doesn't have issues that would qualify him for the 504 plan. But I said, I don't know if this will happen in high school and if it's going to be harder for him for me to get that care that he would need, if it's needed.
Yeah, so I'm thinking about a diagnosis of other health impairment. Could the diagnosis of other health impairment be the qualifier for a 504 plan services? Would that?
Again, it would be the mobility. It would be asking for the evaluation by the team, the therapy team that's within the school to kind of take a look at his function. Most schools do have physical therapists involved. Unfortunately, they don't typically have high caseloads. They're kind of I don't want to say lower on the totem pole, but we don't focus a lot on rehabilitation of walking or those skills within the school because they unfortunately, according to the school systems, do not impact education. And so I would ask for that evaluation to take a look at it, and it's going to be making those accommodations so that he can get to and from classes, because that does fall under the OHI, otherwise health impaired diagnosis.
that we can give out within the school systems. My email is at the end of this. Like I said, I'm about to walk into the woods, so I'm not going to be accessible until July, end of July. But like, you can reach out to me, and I am happy to help guide you through that process and help you find advocates within your area. There are plenty of, within any IEP or 504 that you're trying to get for a child, we can help you get advocates. And so I'm happy to help with that. Just reach out to me. Mine's the one on the top. Ooh, look at that. So.
Excellent. Thank you so much for your question, and we're happy to talk to you afterwards, and we'll be here throughout the day. Thank you so much, panelists. Thank you, Marianne and Conrad and Kimberly, for sharing your knowledge and expertise. And thanks everyone for attending today. Just a little plug, we're going to be moving next door to do another panel on hearing concerns for NF2. So if you have a question about hearing loss or hearing function, join us next door. Okay, thanks everyone. Have a great day.